And then on Thursday, it's December. Almost unbelievable that we're at the end of a year, and what a year it has been. Amen. But God is good. Praise God. I know some people are not going to be looking forward to December. December last year, we had like 3 funerals back to back going into the first week in January. We had 3 people that died, and it was a very sad time for the church that we lost so many people back to back. But God is a good God, and we're believing God that we will not have that this year. All right. I'm just setting up YouTube so I can go back to this. All right. Amen. All right. Rachel, if you could just raise your hand so I can see where you are. You're using another device, and I want to know which device you are so I could make you a co-host. No, that's not it. All right, I see Jennifer. All right, I know Rachel was having problem with her laptop, so she was using another device, and I am waiting on her to indicate where she is. Amen. But we talk about poor circulation, and I'm just going to give you an example of how changing your lifestyle can assist and help with your health. I remember a couple of years ago, my brother went to the doctor because he was not feeling well. And when he got to the doctor, they asked him, "How did you get here?" And he said, "I drove." And they said, "How did you drive?" He said, "I drove." He said, "I drove my vehicle." His blood sugar was 700. And at 700, that is a very high blood sugar. And at that point, he should have had a stroke or something. And they were saying, "You sure you drove yourself?" And he was saying yes. And I'm still waiting to see Rachel. Amen. And his blood sugar was 700, and he decided, and they told him how lucky he was to be alive and even to make it to the hospital by himself. So he decided he was going to make lifestyle changes to fix that problem. So what he did, he stopped eating meat and he went just to eat fish. And he started to eat a lot of vegetables because he's a man don't like vegetables. He started to eat a lot of vegetables, and he cut out rice, and I was juicing for him every day. And within, I think it was like a year or 2, his blood sugar went back to normal level. Now, he was never fat. He was never overweight. And so the overweight was never a problem, but his blood sugar went back to normal level, and that he was not on any medication. So he went from 700 blood sugar reading to normal levels in a short period of time because he was willing to make the lifestyle changes. And that's what we're encouraging people to do, because if you have high blood pressure, and people like to say, "Oh, my blood pressure medication is good," but over time, high blood pressure medication damage your kidneys. So by the time you're in your late 60s going on to 70s, especially amongst Black people, then they have kidney problems. And I don't understand why I don't see Rachel. She told me she was using another device, and because her computer, she couldn't get the computer to work. All right, I'm gonna have to call. Oh boy. Let me see, I may have to go and call her because this is not like her. All right, give me a minute. Let me go and call her because this is not like her. Sorry, Facebook, you're gonna have to come back on. Just give me 1 minute to find out what happened to her. I have to call her. Just give me a minute. What happened?
No.
Wow. I have not seen her. Oh boy. All right. She said she was left her computer at home, and so she was using someone else's computer. Okay, so we're back on. She was using someone else's computer to, she's here finally. All right, Rachel, praise God. You had me worried there for a bit. Amen. So I was just saying that just making lifestyle changes, how it can affect your overall health, because he went from having a blood sugar level of 700 to normal levels in a short period of time. And his problem was not the weight, because my brother is never overweight. There is no fat on his body, and nobody would have suspect that he had diabetes. He did not know he had diabetes. Rachel, please raise your hands as, oh, she hasn't joined yet. And then when they gave him that reading, he just got into action. He went into action immediately by making the lifestyle changes, cutting out the rice and eating properly. And he got it in normal range without and came off any medication. And you can do the same thing too, because when you have problem with your circulation, it's just going to affect you overall general health. All right, Rachel, over to you. You're muted.
Okay, give me a few minutes. I'm opening the document.
Oh, okay. All right. So it can affect you. So we have a list of questions here, and we're going to get through and as much as possible to answer these questions. But the importance, and another suggestion that I had given yesterday to cut back on some of those fat that can lodge in your arteries, so for you to have arteriosclerosis, or when you have cholesterol, do like what the Chinese do. You can drink tea. You drink tea when you're having your meal, because just like when you have fat on your plate, like if you eat and you and when you left over the fat on your plate, and the fat will harden. In order for you to wash that plate, you have to get hot water to melt the fat. When you're eating, instead of just drinking cold liquid, all right, instead of eating cold liquid, you can start to eat have a cup of hot tea. It will literally melt the fat as you eat. But we're not advocating eating a food that are rich in fat. But if you do that, then it can melt the fat. So that is something that you can use to help an overall good health. Diet and exercise. Swimming is a very good exercise. It's an overall general health exercise. But if you do not have access to a pool or to the river or to the sea, walking is a good exercise that doesn't cost much. You don't have to join a gym to do walking. You can just walk on your own, and then that will get you into a better place in terms of general good health. Amen. Amen. Let me know when you're ready, Rachel. We're seeing spider veins. That's what's on the screen right now. We cannot hear you, Rachel.
Oh, okay, are you hearing me?
Yeah, it says peripheral vascular disease. That's what's on the screen right now.
Okay, so I think we went through. All right, so this was where we left off yesterday. All right, so I know we have some questions, but what I'm asking you to do, just allow me to complete because it has some things that I want to explain, and then you can leave the answers for the end of the presentation. So just write down your questions, and then I will be able to answer afterwards. But I need to show you some diagrams to explain what is happening. All right, so we mentioned yesterday that peripheral artery disease is the most common form of PVD, and PVD is peripheral vascular disease. And remember, we mentioned that the vascular conditions are anything have to do with the vascular system. So high blood pressure, diabetes, and we also have peripheral artery disease now, right? So it is a blood circulation disorder that causes blood vessels outside of your heart and brain to narrow, right? Block or go into a spasms. And you know, when you're having a spasms, it's like it's basically closing up, which pretty much affects the circulation. So this can happen in the arteries or veins, all right, as we had mentioned previously. Peripheral vascular disease typically causes pain and fatigue. Now, why it causes pain is because, as we mentioned, once you're having limited blood flow, then you're automatically going to have inflammation. So once it triggers an inflammation cascade or inflammatory cascade, you're going to have pain, right? Because the signs of inflammation is pain. You might have warmth to the area or redness, right? Those are some of the signs of pain. The fatigue is going to cause from once you're having decreased blood flow, you're also going to have a limited oxygenation. All right. So that's what most persons who are anemic, they tend to feel tired very easily. So they will go from point A to point B, not a long walk, and they start feeling tired. Now that is because the oxygen carrying capacity that is actually done by the hemoglobin is being affected because the person's hemoglobin level is low or the circulatory volume is low. And remember that the circulatory volume has hemoglobin in it because the hemoglobin is what binds to the heme, which carries the oxygen. All right. Okay. So as we said, the pain usually improves with rest, and it can also affect the vessels that supply the blood and the oxygen. And as we mentioned, that the PVD mainly affect your arms, it can affect your stomach, and it can affect your kidneys. And remember that we were telling you yesterday that most persons with acute kidney injuries because of the poor circulation, so enough blood supply is not reaching the kidneys, and so the kidneys will actually shut down, because the kidneys is actually driven by the glomerular filtration rate, and glomerular filtration rate is actually driven by blood pressure. So if your volume is low, then you're not gonna have enough pressure, right, to drive the volume, right, enough blood flow to the kidney to perfuse the kidney, so the kidney starts shutting down, or it will suffer what we call in medical terminology an insult. All right, so it said in peripheral vascular disease, blood vessels becomes narrowed and blood flow decreases. This can be due to, as I mentioned yesterday, the arteriosclerosis, or which is the same as hardening of the arteries. And we told you what hardened the arteries yesterday, which is the fatty deposit, which build up over time that blocks the vessels, or sometime with aging naturally, the blood vessels become hardened due to aging, the aging process. Or it can be caused by blood vessel spasms. All right, so sometimes a person's with like autoimmune conditions, then you can actually naturally has a spasm as a result of that. Or it might be any inflammatory process that is happening that can actually lead to the spasm. So it says in arteriosclerosis, plaques build up in the vessel, and plaques is what we're talking about. It's the same thing as fatty deposits, and limit the flow of blood and oxygen in your organs and limbs. So the other causes now is that you have an injury to the arm and leg. So you know, if you have any injury to the arm and leg, that is going to affect your artery or the vein. So the vein may not have much blood supply like the arteries, but you know that the arteries carry oxygenated blood. So in a situation where you're having, say you have a chop wound to the arm, or a gunshot to the arm, or any trauma to the arm or the legs, that can also cause you to have peripheral vascular disease, because sometimes the injury that you get would have caused some permanent damage, and even when they do repair, you still don't, it's the blood still doesn't happen to circulate as before. So you end up with PV to the arms or the limbs, depending on where you're having the injury. Then you will also have irregular anatomy of muscles and ligaments. Now, irregular anatomy can be, sometimes it can be hereditary, some conditions that you were born with, or it can be over time. You might get a torn ligament or a torn muscle, right? So if you're having a torn ligament and a torn muscle, and then you're going to have inflammatory process as a result, then that can also affect circulation. Now, infection is the third one. And with infection always triggers an inflammatory response, because it's the body's natural ability to fight. So once the body trying to start fighting, then you're going to have an inflammatory cascade being triggered. And so that too can affect circulation. All right, so the signs and the symptoms of PVD, as we mentioned, that weak pulses. So why you're having weak pulses? Now remember that when you're having limited blood flow to an area, now the blood flow is what gives you that pulsating effect. So if you're having limited blood flow, of course the pulse is going to feel weak and churny. And that is one of the signs when we know sometimes that our patient is anemic, even if we don't sometimes see hemoglobin results or the results of a CBC, right? Which is the complete blood count. So it would look at their hemoglobin levels, their white blood cells, their red blood cells, the different types, the neutrophils, the different types of white blood cells, and so on. So hair loss on the legs. Now, why do we have hair loss? Remember, we told you yesterday, so the blood actually forms a very important factor. So the blood is actually what warms the body as well. And if you're having poor circulation to that area, one, it's going to trigger an inflammatory cascade. And two, as in the situation, if sometimes in the Raynaud disease, when you're having extreme cold temperatures, then of course the hair is just naturally going to follow, because it's not the normal temperature that it's striving to cause growth. So those are factors that is now going to cause you to have hair loss on the legs, because mainly is that's where you mainly have the poor circulation. So it can happen in the upper arm, but it's mainly found in the lower extremities. And we say as well as gangrene, and this is dead tissues due to lack of blood flow. Now, gangrene, we mostly see this in our diabetic patients. They tend to have gangrene because, as we mentioned, that diabetes really affects the circulation, right? And so later on, they end up with the neuropathic pain, and the neuropathic pain is also caused from nerve damage, and the nerve damage is caused from the fact that they have limited blood supply. So the nerve, right, that is actually the whole impulse, right, the nerve impulse and the nerve conduction pathway, that is driven by impulses too, which is actually driven by your whole circulatory system as well as, because remember that the circulatory system is connected to the nervous system. All right. So the brain and the spinal cord is connected by impulses that travel from the brain to the spinal cord. But these impulses travel along a nerve pathway, a nerve conduction pathway, and that too is actually driven by the flow of blood. So we see how important the circulatory system is. It basically typically affects all the other systems. And then we have, as we mentioned yesterday, that impotence. So we have our sicklers, sometimes that they come in with one of the main problems that they will have when a crisis is the priapism, where they have a painful erection, right? And sometimes it actually takes surgical procedure for it to go down. Or we may have, what's wrong with this computer?
Hello.
We have the screen that says other causes of PVD.
Yeah, but I passed there. I'm trying to get back to I'm not using my laptop because I left my laptop, so this computer is not so user-friendly. It's very slow. All right, so impotence, as we told you, and that was one of the conditions I told you that tend to actually plagues diabetics a lot, especially when the blood sugar is not being controlled, because as I told you that an erection is actually caused by blood flow that is triggered by the flight-fight response when the partner sees the person and they're actually, elated, and the whole response, the whole flight-flight response. So the persons get an erection because there is the blood flow now flows down to the penile pathway, and that is what caused them to get an erection. So with a person who is diabetic, remember that I said it affects the entire circulatory system. So even the blood flow to the penile area is going to be affected as well. So diabetics over time, when the sugar is not being controlled, then they do end up with impotence. All right, so another factor is the varicose vein. So remember yesterday I was explaining now that when the blood goes to the feet, right, it is very important that the blood gets back to the head and the neck vein for the entire circulatory system to continue. It's a continuous process. But in order for that to happen, you have first I want to show you there's a varicose vein there, which is actually the fatter veins. And then you have the spider veins, which is still a varicose veins, but it's actually the milder ones, right? And varicose veins are actually superficial. So they're actually superficial to the skin tissues. Then later on, you will see about the deep vein thrombosis, which is actually the deeper veins. And those are the ones that can actually be life-threatening, right? Because that clot can dislodge and go to the lungs and give you a sudden death by calling a condition called pulmonary embolism. All right, so the normal flow is that when you walk, so when the blood flows when the blood flows down to the feet, there is a one-way valve in the foot or the feet, both legs, right? And the normal blood flow is that if you notice the arrow is going up, meaning that it is supposed to go back to the heart, right? But before it goes back to the heart, it goes to the head and neck vein that I showed you before, which is the subclavian artery, right? And the subclavian vein, and then it goes to the right atrium, then to the left atrium, as I told you yesterday, then to the pulmonary artery to be oxygenated. Then the pulmonary vein takes it now to the left atrium and then to the left ventricles, and then it goes to the kidneys and down to the feet, in the abdomen, down to the feet. All right, so the valve is usually an organ that is supposed to close and open. So what valves does in the body? We have valves in our hearts and we have valves in other areas of the body where they have arteries. These are what actually closes and opens at intervals to allow backflow. They prevent backflow. So where the mitral valves that we have in the heart, right, and the aortic valve, right, when the heart pumps blood to a certain level, what it does, it's actually, the valve closes, right, and allow the blood to flow, allow the blood to flow to a particular area, right? So you don't have that backflow, because the backflow of blood can actually cause mixing. Because remember now that there's a certain area in the heart that has oxygenated blood, and there's a certain area that has deoxygenated blood. And that is why persons with valvular stenosis, where the valves become stiffened after some point in time and it's not able to close, those persons tend to have cyanosis. Now, what cyanosis is basically bluing of the skin, right? And that is because of decreased oxygenated blood to those tissues. So if you're having a backflow, right? So the blood is supposed to be out, but you're having a backflow because the valve is not working to close off when it is supposed to. So you're having regurgitation. Supposed to be going down is actually regurgitating up back in one place. And that too, as we mentioned yesterday, can cause stasis. And once you have stasis of anything, then there's clot formation. So persons with those conditions can end up getting a heart attack, or you can get a pulmonary embolism, or you can even get a stroke. So once we have any form of that, sometimes we do like a valve replacement therapy. And most babies that are born with heart conditions, whether you have atrial septal defect or ventricular septal defect, they mean that there's a hole in the ventricle. So the hole prevents the blood from flowing to the atrium and the ventricles, respectively, as how it's supposed to flow along a normal pathway. So because of that, now you have a mixing of the blood. So you have oxygenated blood mixing with deoxygenated blood, and so sometimes those babies will look blue, right? So you have to give them like supplemental oxygen therapy, and even over time, you just have to do surgery for them, because if you don't, they will actually die, because the more they grow is the more activities required of them. They become tired easily, even when they cry. That is use of oxygen, right? To move, to walk about, it's basically using up oxygen for them, right? And they basically know the body is demanding the oxygen more than they are able to supply, because the heart is not functioning normally. So that is the function of the valve. So when this valve here is not able to close off, right? So if you notice that the vein here is blue, the red part here is supposed to be the artery, right? So the blood is flowing along the artery, right? So it goes through the valve closes off, and then it flows up into the artery to go back to the head and neck veins. All right, but look what happens now with the varicose veins. So what happens with varicosity is that there is increased pressure, right? That now starts happening in the vein, either because prolonged standing or prolonged sitting. Either one of them is now going to start pooling of blood into the vein. All right, and that is not supposed to happen. Remember that once it goes to the vein, once you walk, the mechanism of walking is supposed to pump back the blood up along that one-way valve back into the heart and lung. So what is happening now when the blood flow becomes so overwhelming, because the vein is not supposed to be storing all of that blood. So the pressure within the vein start weakening the valves, right? And once the valves now become weakened, if you notice what they're showing you here, the normal process is that you're supposed to have a one-way flow, right? So when the valves becomes weak now, it loses its ability to really close off as it should. And then you have now a backflow of blood that is supposed to go back to the head and neck vein. Some of it is actually pulling back down into the lower parts of the feet here. So that is what is calling varicosity. So it's basically a bulging. So when you see the varicosities now, it may look bulging and you're saying that, okay, so there is more blood supply. That's not necessarily so, because when the vessels become so dilated now, it reduces the flow of blood into the veins, right? And so it becomes painful. Sometimes the feet feel sore and so on. So varicose veins are not really life-threatening, right? But later on, you can see what is happening with every situation. Even though it's not life-threatening, it can become life-threatening, because some persons tend to get like a sore on the foot, right? Or an ulcer because of the same poor circulation. And once you have a cut, there's risk for infection, and that infection can actually lead to sepsis, where the infection now goes into the blood. And we rarely see patients survive from sepsis. Even when we have them in ICU, the prognosis of that is very poor, because once you have sepsis, there's a multiple organ failure. So all the organ systems in the body start shutting down, right? So at that point in time, it would just be the what we would call it, the ventilator, that will be working for you, but it would still be difficult because, as I mentioned, like, it's the entire organ shutting down. So even when you do your best, sometimes you still lose patients with these conditions. So as we mentioned, even though it's not life-threatening, if it comes to the point where it actually start leading to sore or, you know, an ulcer there, then you can have a problem. Oh boy, it's a pain using this computer. Okay, so it says varicose veins are enlarged, twisted veins, and this can happen anywhere in the body. So I'm sure a lot of you are not aware, but we do have pregnant women with varicose veins in the vulval area there. That's the area of the well, I don't want to say the area of the pubic area that the ear grows, because the vagina would have been the opening. So at the top there. So pregnancy do cause a lot of changes in the body. And as we said, anywhere where there is increased pressure, right, then it can lead to varicosities. And that is what happened with a pregnant woman now. There would actually be increased pressure down that area because of the baby, right, that is actually at the lower part of the abdomen growing up. So that can actually cause varicosity. So it can be anywhere in the body, as is stated here, but it's mainly common in the legs, because that is mainly the pressure of us walking, and it depends on the work that we do. Anything with that cause a lot of weight bearing in our lower extremities, then it can actually lead to varicosities. If you're sitting down for prolonged periods, remember that the blood will be pooling in the feet, and so because of that, that is going to now cause increased pressure, right? And the increased pressure is going to weaken the valves, so you have an impairment of the flow back to the head and neck veins. So as it said, it's not considered a serious medical condition, but they can be uncomfortable and lead to more serious problems. And some of the serious problems that I told you about is that you can end up getting sepsis when the legs become infected. And it said that they may be very noticeable, and they may cause people to feel uncomfortable or embarrassed. So as nurses, one of our key roles that we do is persons tend to have body image disturbance. Not everybody bothers them, but some people do. It depends on your self-esteem, your level of self-esteem, and your confidence level. They do get affected, feel affected and embarrassed by these things. So we have to really counsel them, you know, and, you know, just try to, you know, give reinforcement and, you know, encourage them along the way in situations like these. All right. All right, so the spider veins, as we mentioned, oops, this is all over the place. Spider veins, which we say are basically milder all right, it's right there. This computer is giving a lot of problems. All right, so all the other slide was saying is that the spider veins are actually the same varicose veins, but it's just a milder form. And if you notice, these are 4 pictures that I'm showing you. So you have a normal leg where you have no visible signs of venous disease. And then you now have the second picture. You notice the spider veins right close down to the heel back there. So they're barely visible, and they can be either red or blue in color. All right. And so down here now, these are the bigger ones, which is the varicose veins. And you notice that they are more visible than the spider veins. So now When you have too much varicosities now, you see what is happening now because of the limitation now to the blood flow. You notice what is happening here now. The feet now become so odomatous because remember we told you now that the one-way valve in the feet is actually now damaged because the valve has become weakened. So you're having a backflow of that blood. So there is pooling in the feet, which is actually causing the edema. And then that pooling now becomes, the tissues now die because they're not getting much oxygenated blood. The circulation process is impaired. So all of that blood staying down there now becomes static, right? There's stasis, the cells die. And so now you end up with a sore, which we call a venous ulcer. Now what we see now, and these are actually prominent in persons with sickle cell. I'm not sure if you know persons with sickle cell. A lot of them sometimes, especially when they have it very bad, you will see them have leg ulcers and they will heal. And then at another point, it will break out. And persons who have varicosities that are very bad, like too much, like to the entire leg area, that is what happened. So you have an active ulcer that is formed as a result of the poor circulation and the inflammation that is going to occur from the blood not circulating as it should, and tissue death and all of those things. So that is what actually leads to the venous ulcer. All right, so in everything, it is very important for us to do our history taking. All right, and the history taking, it involves a family history. So first, you want to know, as we mentioned, poor circulation is not a disease in itself. So you would have to have some other vascular condition, whether it's the hypertension, whether it be diabetes, and we all mentioned yesterday that obesity is the main culprit for these conditions, because of course, obesity leads to diabetes, obesity leads to high blood pressure, obesity can cause other endocrine problems or disorder, and so on. And so obesity can also cause varicosities because that is one of the main things that is going to cause impairment of blood flow, right? So first, when the patient comes, we're not going to just ask them, okay, you're having poor circulation. Poor circulation doesn't occur on its own. There's something that is causing the circulation problem. So is it the diabetes that has become chronic and it's not being controlled? Is it the hypertension? Is it the fact that the person having heart failure? And even somebody with heart failure, unless they have a defect in the heart that they were born with, heart failure is usually caused by chronic diabetes over time and chronic hypertension. So that is how bad these conditions are. All right. So first, you want to ask, involves a family history. You ask if anybody in the family, they have sugar or they have pressure. Those are the layman term, but we know they're diabetes, hypertension, or we know that sometimes venous ulcers are actually hereditary as well. And when we finish taking the history, now we do our physical examination. So you basically assess from head to toe to see what is going on, where else on the body you might be having edema or any abnormalities or any deviation from the norm. You ask about their health conditions, which would be, as we mentioned, the diabetes, the high blood pressure, or any other problem that they may have, right? The blood test for measuring your blood count, remember we mentioned that earlier, that is the CBC. For persons with poor circulation, we're going to look at the CBC because once your hemoglobin level is low, then your oxygen carrying capacity is going to be affected. And remember, we tell you that the hemoglobin, it has 1 em of hemoglobin carry a certain amount of oxygen to it. So when your hemoglobin is low, your oxygen level is going to be low. And that is why persons who are anemic, they normally tell you that they just walk from there to there and they're tired because they feel weak because they're actually impairment of the oxygenated blood to various parts of the body. All right. And even persons who are anemic, they will tend to tell you that they have, like, you know, they're having headaches. Why is that? They're having decreased perfusion to the brain. So enough blood supply, oxygenated blood is not getting to the brain. And the brain is actually function from your glucose levels and your oxygen levels. So we have patients when your oxygen level becomes low, too low, we have patients that can go in an irreversible brain damage, and it's the same for the glucose. So once we see a patient and our patient goes unresponsive, we check their oxygen level and you check their glucose level, because either way, that is going to tell us that this is one of the things that we can check for. This is what is going to key us in to what is happening with the patient. If those 2 parameters are normal, then we know it's something else. It might be probably a stroke or a hemi or something like that, a heart attack. All right. And we mentioned that you also do the blood sugar test, which is actually your glucose. And you might actually do a fasting blood glucose to find out if the person is now going to be having diabetes, or you can do the kidney function test. And when we're actually looking at person's kidney function, it's a blood test that we do, and we look at their bone and creatinine levels. And once we see that those are actually increasing above the normal, then we know that the person's kidney is actually failing. All right, but there are stages of kidney injury, and you can have mild, you can have moderate, you can just have an acute phase and you get treatment for it and it doesn't bother you again. You can have an acute phase and we treat it and we treat it and it doesn't resolve and it goes into a chronic phase. And then the chronic phase now end up going into end stage, right? This is where you need dialysis, and sometimes the chronic phase also leads to dialysis, but not all the time. When it reaches the end stage, now you're being dialyzed, and sometimes even with dialysis after a certain amount of years, you do end up dying, because the problem with the renal patients is that they tend to actually, the potassium levels sometimes actually goes high, which we mentioned yesterday, and we mentioned that the potassium is one of the ions that is responsible for the contractility of the heart, right? That's what causes the heart to beat. So if it's too high, it's going to overexcite the heart until the heart just stops. All right, and we can also do an ultrasound and a CT. Of course, the ultrasound would basically be for persons with a deeper vein thrombosis, as we would know, because most of the person, that's the time when we notice. We can't just see somebody foot swollen and then we say that, okay, they are having a deep vein thrombosis. We have to do an ultrasound to see. The ultrasound is going to show us the flow of blood, you know, along the arteries there in the feet. And actually, we actually use, but before we go through ultrasound, we normally look at the sign of inflammation. So we look at the feet, first assess to see if the foot is swollen. We look for redness. We feel for warmth, because usually if the feet is cold, we know that the blood is not circulating, because remember that the blood is one of the fluid that actually helps to warm the body. All right, so if the area is cold, that's how we know. And even sometimes when our patient is going, and even sometimes when we know that the patient is having lymph ischemia, meaning that there is the cells or the tissues in the feet is going to die, that is because of decreased oxygenated blood to that area. So if you're having decreased oxygenated blood and decreased blood supply, of course the area is going to feel cold or cool to touch. So those are signs that we look at. And then once we see those signs, then we go further and we do additional tests, diagnostic tests. All right, so the treatment, before I go to natural remedies, I want to look at the treatment. Tell me, oh my gosh, this computer's need problems now. All right, so the treatment for poor circulation, it depends on the cause. All right, so some option includes, you can wear compression stockings, right? And these are for painful or swollen legs. You can get involved in an exercise program, because we know that certain, well, most exercise, we have different exercise. You have exercise that are for cardiovascular activities, right? And so on. You have exercise that is actually, that can actually, for physiotherapy purpose, for rehabilitation. So we have various type of exercise, all right? Laser or endoscopic vein surgery. So those are for persons with like the varicose veins. Sometimes they do what is called an ablation or laser therapy to actually like the laser actually tends to shrink the veins, right? But with those, it's kind of, it's a risky surgery, because sometimes they tend to have what is called, the vein can actually, what you would call it now, is that you would say the vein can rupture, which is the same as burst. It depends on how severe the vein was before you do the surgery. All right, and sometimes even when you do the surgery, the varicosities can come back, and it's very expensive. But some persons, as I said, they have body image disturbances because they don't want that on their feet, because of probably poor self-esteem issues and so on. So they might want to do a surgery. And as we mentioned, the medications for the clot dissolving drug or the blood thinners, and that is for the one that is called the DVT. All right, so those are the deeper veins, not the ones superficial, because remember we told you that the superficial ones are the ones that cause varicose veins and spider veins. But the deep vein thrombosis are the ones that are deeper. And those are the ones that we're worried about, because the deep vein thrombosis can actually cause deaths. All right, so it says the natural remedies now. All right, and we mentioned getting your regular exercise. So there are triple therapy, right, for a healthy lifestyle. It's your diet, it's your exercise, and rest. All right, so a lot of people just take it for granted that, okay, I am now diagnosed with diabetes, I can just take my medication and I ensure that I take my medication and it's okay. No, you should always aim at doing some form of rehabilitation. So it's going to take some discipline for me to do some lifestyle changes. What do I need to do? I need to get involved in an exercise program. I need to consult a dietitian, right? And watch what I eat. So if you're going to watch what you eat, you're looking at your amount of calories, you're looking at your portion size and all of that. All right. And also your rest is very important, because remember, if you're not getting enough rest, your tissues actually repairs itself by your rest and rejuvenates itself. That's how your body repairs itself. Your tissues repairs itself by your rest. So if you're not resting, then of course your pressure is going to go up. All right. And once your pressure go up, we see all of these problems that the pressure can cause. It can damage your kidneys, it can damage your heart, it can also damage your eyes. Not as bad as the diabetes, but it do as well. Because as I mentioned, all of those are circular illnesses. Those are vascular conditions that do affect the vascular system and how the blood flows. So we mentioned that consuming a healthy heart diet, right, which provides fiber. And we know some of the foods that are rich in fiber. Your cereal is some of the foods that are rich in fibers. Managing your weight is also very important. Some persons, they notice that they're putting on the weight and they don't take it for anything, and so they continue along that path. Sometimes too, if you're putting on weight, you can also, it depends on whatever the weight causes, because some persons, when they are stressed, they put on weight. The reason for that is, remember that when you stress, the body naturally produces corticosteroids, which is an hormone. Now remember, steroids is something that causes you to put on weight. So even though doctors have medication that they give you, right, to treat a certain condition, your body naturally produces corticosteroids when you're stressed. So some people will tell you, when I'm stressed, I put on weight. Some people will lose weight when they are actually stressed. But managing your weight is very important. All right, you don't want to wait until the weight gets out of control, because as I said, once you start having excessive weight, you notice that you walk from point A to B, you're tired, so you're going to become inactive, meaning that you're not going to want to exercise and burn any calories. And then once you're doing that, then it's going to have a lot of pressure on the heart, and then most of the organs are going to start failing. You're going to end up with diabetes, you're going to end up with high blood pressure, and it goes on. All right, avoid or quitting smoking. Now, smoking, a lot of people don't understand, but smoking is a very dangerous process. All right. There are some vital things that cigarette produces, and a lot of persons don't know. So there's one that we call monooxidase inhibitors. If you notice, it says inhibitors. All right. And so what it does, it binds to the oxygen. All right. So when it binds to the oxygen, just like the name suggests, it inhibits, right, the oxygen to bind to the hemoglobin and to the cells to take oxygenated blood around the body. So it's like it's competing with the oxygen. So automatically you're going to start having problem. And then once you have constant necrosis to the area, later on, you might end up with cancer. All right. You also have something that is called nicotine, right? In this, especially if it's cigarettes, and you have something called tar. Now, as the name suggests, tar, when they smoke that tar, that cigarette, the tar, as the name suggests, it causes the entire area in the lung over a period of time to become black. And so sometimes when we look on the x-ray, we can see that this is a smoker. We can tell by the look of the x-ray how the lungs is looking, and we know that this is a chronic smoker. All right. And then, as we said, we have the nicotine, which is naturally, right, a carcinogenic substance, and carcinogenic substances are cancer causing, right? So these persons know that these things cause damages to health, but you know, they're making the money. And of course, sometimes the nicotine is one of the ingredients in the cigarette that it actually makes you feel high. So that is what gives them that addiction, right? So sometimes we have to give them the nicotine patch. So the nicotine patch is basically like it's inhibiting the function of the nicotine, right? So those are 3 parameters that is in the cigarette that is very dangerous. So once you know that, you basically try to quit the cigarette. I think I'm actually missing out on some of the things because this computer is not. Okay, so it says natural remedies now. So these strategies are essential for cardiovascular health, but your doctor may also recommend combining them with medication. All right, and we know that too, that there are some food that, especially grapefruit, that actually works against certain medication and it can actually kills you. So with everything that you're doing, you have to sometimes speak with your doctor. All right, because some of especially the blood pressure medication, the grapefruit sometimes prevent a lot of those from working. All right. And some persons use supplements to improve circulation. I mentioned the vitamin E, your multivitamins and your minerals, your antioxidants. Now, food that is rich in antioxidants are very important. Naturally, your body produces oxidation it's a chemical process that goes through your body when you eat. So when you have oxidation, sometimes what it does, it basically, you will have 3 chemicals that normally produces 3 chemical atoms that is actually produced to the body. And then once you have those, then you will have the third one, right? It can actually produces a free radical, right? And what the free radical does, it's actually can be carcinogenic. So it can cause you to get cancer. So you need food that, as we said, that kind of helps prevent these or kind of lower down the oxidation processes in the body. All right. And that will also prevent you from getting cancer later on. And we will see some of the foods that will prevent that. All right. So we mentioned folic acid, because you know folic acid, it actually gives you some source of iron as well, and it helps with this circulation. You have niacin, beta carotene, and some of these, as we said, there is not enough evidence to confirm that they're effective and may not be safe for some persons. So we know that some of these, it depends on the condition that you have. While it's good for some persons who are healthy, there are some persons with other health conditions that these can actually have a contradicting effect. So some of these issues you have to always check with your doctor to ensure. All right, so there are some foods that we have here that can actually increases your blood flow, right? And we mentioned that the onions, because the onions has oxidants and antioxidants. And as we mentioned before, that oxidation is a natural occurring process in the body. However, when it actually occurs too much or too rapidly, then it actually produces free radicals. And free radicals are actually chemical organisms in the body that can actually cause cancer forming, right? Cancer forming cells. So when you actually eat these antioxidant food, it actually inhibits, right, the whole free radical process, or slows it down, right? And it lessens your chance of getting cancer. Garlic is another good source. If we notice that we hear a person say, some of our patients will come and they tell you that's okay, they eat garlic and the pressure went down. The thing with the garlic is that sometimes you have to, I will tell my patients, okay, if you're taking the garlic, then do not take the medication, because sometimes some of these things can actually cause an allergic reaction. And if you're taking both at one time, or you're actually going to have a reaction to it, you're not going to sure which one is actually causing it. Because even though it's natural remedy, you can get an allergic reaction to it, just like how we have food allergies. Then you have your cayenne pepper, and this one helps to lower blood pressure and stimulate the release of nitric oxide. No, nitric oxide is actually a vasodilator. Now, with high blood pressure, right? What high blood pressure does, it actually causes vasoconstriction. So the blood vessel constricts, meaning that it's actually like closing, so it decreases the blood flow. So when you eat these type of food, the cayenne pepper, but it has to be careful with that, because somebody know with an acidic stomach, like probably an acidic reflux or also stomach, you wouldn't want to have too much pepper. So it can be contraindicated with somebody else with another health condition. So we have pomegranate as well, and this is high in polyphenol, antioxidants, and nitrate. And again, which you mentioned that all nitrate-based foods are actually rich in their vasodilators, and vasodilators actually, as it mentioned, dilates the blood, so it makes the blood vessels become wider, so the blood flow increases. All right, we have cinnamon, and again, it improves blood vessel dilation and flow to the coronary arteries. And those are the arteries that actually are found within the heart. We have fatty fishes, and these are such as salmon and mackerel. And we said that these are excellent sources of fatty acid omega-3. And these fats are especially beneficial for circulation because they promote the release of nitric acid. And we mention again the importance of nitric acid because it actually is a vasodilator. So when you have high blood pressure, diabetes, all of those are vascular conditions. And because they're vascular conditions, they do triggers an inflammatory response. And the inflammatory cascade is a whole lot of cytokines and a lot of things that is actually being released at the same time, working against the body. So with the inflammation process, it's like you're actually, it's closing down the vessels, because sometimes the vessels, that's their way of trying to compensate, right? But even though it's actually compensate, you're actually having the signs and symptoms from that ripple effect that is happening that the body is trying to do. So these are foods now that increase the blood flow. All right. So we have beets, and most of us know that that's the beetroot. And we know that that's actually rich in iron. It's an iron-rich food. It's not very tasty, but that is some of the things that we tell our patients when their blood level is low, their blood count. We said, drink up your beetroot, or you can, blend your callaloo juice and stuff like that. But we always ensure that any food that is actually rich in iron, you ensure that you take it. You can ensure that the patients put lime in it, because as we mentioned, vitamin C improves the absorption of iron. So if you're actually drinking the beetroot and you're actually going to put the box milk in it, which is dairy based, then the iron is not going to be absorbed. So you're just drinking it in the body, but it's not going to be absorbed in the cells. So it's not going to improve the blood count level. You have your turmeric, which basically this is natural traditional Chinese remedy, and also it helps to increase nitric acid production, right, and reduce oxidative stress. So as we mentioned, that the oxidation actually produces free radicals, and we mentioned that too much free radicals, if you hear they're talking about the oxidative stress here. So over time, too much oxidative stress, those are the things that sometimes leads to cancer. Talk about your leafy green, whether it's your, other persons have different things. Some persons use their string beans, anything green vegetables. You can use your callaloo. Some persons use lettuce and they can blend them, right? And those are good. Your chocho is also a good form of antioxidant, so that too can be used. Tomato may also help to reduce angiotensin converting enzymes, right? Which causes blood vessel to constrict to control blood pressure. Okay, so naturally, sometimes what we do here, when somebody has blood pressure, so we have different blood pressure medication that we give them. we have some of them that are ACE inhibitors, all right? So ACE, what it means is angiotensin converting enzyme. So the body naturally releases these enzymes, all right? And it actually causes vaso constriction, all right? So if you're having vasoconstriction, right, it's like the vessels are actually closing. So the flow of blood to the vessels actually decreases, all right? So what the tomato does, right, it works as an angiotensin converting enzyme. So it converts the enzyme, so there are phases from angiotensin 1, it prevents it from moves to the angiotensin 2. So the angiotensin 2 is what leads to the severe constriction that can actually increase the pressure. Because remember, if you have a hose, right? If you have a hose and you're actually, the flow from the hose, if you notice when you have a hose and you actually put your finger over the edge of the hose, the tip of the hose, to actually prevent the flow of water or limit the flow of water, if you notice it's going to come out into a spray format, right? So if you hold the hose normally and you don't occlude any part of the hose, the water is running out at a regular flow. But the minute you try to occlude parts of it, what you notice, it's going to spray. That's increasing pressure. So that's the same thing happening with the blood vessels, right? Because the blood vessels are occluded, so the blood flow is actually limited to the organs or actually the cells. And what you actually find now is that the pressure now increases. And that is why a lot of persons sees that they have increase in their blood pressure. All right, so we have ginger. We have our ginger. Oops, again. We have ginger, and we have other methods. As we said, you quit smoking because we told you the effects of smoking. It increases your physical activity, right? You reach or you maintain a moderate weight, because we have what we use to control person's weight. We look at your height and your weight, right? Which we call is your body mass index. So you have to ensure that you maintain a body mass index, right? That is basically below 25. All right, because once you're actually going up between 24 something, that is actually overweight. And once you see you start getting overweight, then it means that you're actually closer to becoming obese. And obesity is actually one of the cause that many chronic illnesses. All right, and as we mentioned, you stay hydrated. Now, what a lot of person don't know, we have a lot of elderlies. We have sometimes babies that will come in and they're dehydrated. All right. Now, if you're dehydrated, of course, it's going to affect your circulation as well, right? Because when you're actually dehydrated, it decreases your blood flow. It's just like somebody that comes in. So even though you're not getting enough water to hydrate the cells, right? So if you become dehydrated, so the kidneys now is automatically going to suffer, right? And then you're going to notice that you're not putting out as much urine. So that's happening over time, right? It actually causes an inflammation now to the renal cells. And so you basically you can actually end up with acute kidney injury. You can end up with renal failure as well from being dehydrated. It depends on how long you're actually being dehydrated for. And that is why when persons come to the hospital or persons have diarrhea, we try to hydrate them by giving them like the fluids, because if their vessels are not getting adequate fluids, then of course that's actually going to limit also their blood pressure, right? So most persons, 95% of persons who are dehydrated, especially if it's very visible, because some of them you can see their eyes are sunken. When you pinch the skin, it's actually taut. We know that those persons are actually dehydrated. And once you're actually dehydrated, then it means that your other organ systems are not gonna, the blood supply to those areas are going to be reduced significantly. All right, and that can actually cause, as I said, renal damage, and it can actually cause death. So we do have some of our elderlies coming with severe dehydration to the point of death, because what happens is that the kidneys shut down, and by the time we get to reach them, it's actually too late, because sometimes we try to get them to do dialysis, but sometimes dialysis is not always available. on how many persons we can get to the dialysis department, or how many persons they can accommodate, because that actually department is actually fully booked, right? Because it's free, and you know that dialysis per day is basically 10 to 12,000. Some persons have to do dialysis 3 times per week. Some persons have to do dialysis 2 times per week. So it's very costly. It's very costly. I think that's it. So that's the end of my presentation.
Okay, and now we have a lot of questions and we're over our time. All right, so let me start now.
Okay.
It says, how does a person with hyperthyroid manage circulation? How do you do that? Oh, let me put that in here.
Okay, so the first thing they have to do, because they have to ensure that they actually take their thyroid medications. The thing with the thyroid is, and sometimes too, that can be controlled by the diet. It depends on which one of the thyroid hormones that is being affected, because we know that some persons' thyroid are affected by the fact that they actually lack salt in the diet, not the regular table salt, but iodine salt. So the iodine is actually one of the factors that prevents thyroid issue. So even though we say that you're not supposed to eat salt, for some persons we have to tell them, you know, especially if they have thyroid issues, that they should consume a diet that is actually rich in iodine, right? Or, you know, some of them you have the sea salt that is actually rich in iodine, but you wouldn't want them to eat so much salt. Now, the problem with hyperthyroidism sometimes is the fact that it actually, because of the fact that the thyroid hormone is actually elevated, what it does, it affects the blood pressure. So once it is elevated, then of course your blood pressure is going to go up. And sometimes the blood pressure and the chronicity of the blood pressure, that is what is going to cause other problems later. And so some persons with hyperthyroidism then can end up with heart failure. So for the persons with the thyroid issues, is the best thing that you have to just take your medications.
Okay, is foot massage good for poor circulation?
Yeah. Foot massage is it's actually good. Remember I said that yesterday, because you're actually enhancing the blood flow, and it depends on how you massage the feet. So, you know, you can actually move from upper to lower and from lower to upper, but always ensure that you elevate the feet. So if you're sitting down, you can elevate the feet on probably like a stool or something, or a chair. And so that actually helps the blood to go back to the heart, right? If you're sleeping, you can actually elevate it on a pillow. And most persons will tell you that when they went to bed, when they actually elevate and they woke up the other morning, it went down, right? So as we mentioned, some of those persons, you don't really get totally rid of the edema, because the valve in the feet is already damaged because of the excess pressure on that feet based on the edema that you would have actually been time.
Okay. Someone have their phone open. All right, so we have a question. It says, does poor circulation causes cramps over the body? I think you said cramping was a sign of
yeah,
poor
cramping is
circulation. Yes, that's a sign.
Remember that you're not getting enough the blood. That is an indication to tell you that the blood flow is actually being restricted. If you notice you're sitting and you cross the legs, and that's why we also encourage our patient not to cross the legs either, because when they cross the legs, what happens is that you're impairing the circulation. And sometimes when you cross the legs for a prolonged period of time, if you notice when you uncross the legs, you're having cramping, because you would have actually impaired your circulation for a period of time. So yes, that's one of the signs that the cells is telling you that, listen, we're actually lacking blood. So those are actually signs to tell you that your circulation is impaired.
Okay, someone is saying that the doctors say I have M protein and currently sees an oncologist and hematologist. What can I do to keep the M protein down?
The doctor says what?
That they have M protein. What is M protein?
M protein?
Yes.
M protein or protein?
No, this is M protein. I don't know what, I've never heard of M protein. I thought probably you would know. But they're seeing an oncologist, which is a cancer doctor, an hematologist, a blood doctor. What can I do to keep it down? I've never heard of that one. That one is beyond.
Oh, M as
M, the letter M.
M as yes,
Like
yes.
M dash protein.
Those are usually abnormal protein that is caused by the plasma cells. I don't even know what to tell them, because sometimes some of these proteins are caused by other factors. They're triggered by other things that is happening in the body. Sometimes, as I mentioned, it's because of, as we mentioned, too many free radicals is being actually produced in the body based on the type of food that they're eating. So for one, some of the food here that I mentioned, they can try to improve their food, especially food that are rich in what should I say, alkaline based foods. So you can get those from your broccoli, your cauliflower, your lettuce. Those are alkaline rich foods. So once you try the alkaline rich foods, what it does, it decreases the acidity of the blood. And so you can help to control some of these proteins. If it's naturally occurring from an autoimmune condition, because remember, autoimmune conditions is something sometimes that we say the cause is really idiopathic. We don't really know why sometimes the cells start attacking itself. So it's your body good cells start fighting against each other. And so some of the autoimmune problems that person may have is like lupus or what do you call it now? Arthritis. Some of those problems are autoimmune. So it depends on the type of diet that you eat, then you can actually control to get rid of some of these protein that can actually, these are actually abnormal proteins, right?
Oh, and they gave the definition as monoclonal protein. Right. We have Dr. McGee on the line. If anything you think you could add to, you can jump in anytime. Somebody's asking now, when should I have my last meal on a daily basis? That will vary for different people, but we were talking about diet and the importance of diet, but you just should not eat and go to bed. You should not eat and go to sleep.
I think between 6 and 7 is a good time, but as we mentioned, at no particular point in time we should be having a heavy meal. Once we're having,
go to bed, yeah,
is that we should be having small frequent meals, right? But once we actually don't eat and fall asleep, because that's what happened when we actually eat and fall asleep at the same time, we don't get to burn any calories. And some of the foods now that we eat, it's actually going to store. If it's actually excessive glucose, then it is actually stored and it becomes glucocorticosteroids, which is actually stored as fat, right? And then it's sometimes now when we become hungry, sometimes the cells now, the body now draw back for those actually glucocorticosteroids, break them down actually to, so you can actually have some form of sugar to maintain you for a period of time. But it's not really good, really, to eat at a late point in time if you know that you're not going to be doing much activities, because that is how your body is going to store all of this excess fat. And we know that especially most of the time where you tend for those fat to be stored is around the abdomen, the waist. And there are actually studies that show that there is increase in abdominal girth put you at risk for diabetes.
For diabetes.
Something that actually prevents the receptor site from binding to the insulin, right, to bring the glucose into the cells. So
and another thing that people could do, depending on your work schedule, then I'm going to allow Dr. McGee to say something, is that you can reverse the way you eat. That you can have your heavy meal during lunchtime when you're actually at work and you actually need that energy to do your work. And when you have your meal in the evening, because you're going to go to bed and go to sleep and you're not so active, you don't have to have this big heavy meal. Because I have breakfast and dinner, and my dinner is between 3 and 5. Anything after 5 is vegetable and nuts, on fruits and nuts, but I don't have heavy meal in the night because you really don't need that energy. All right, Dr. McGee, can you go ahead now and make your contribution?
Oh no, I just meant about the MGUS. They were talking about the M protein.
Yeah, go ahead.
It is not really a serious reason for concern and there's nothing you can really do to minimize the risk of developing it. It's just that you just have to do frequent blood tests, make sure you do your checkups, that it doesn't develop into any other serious cancers such as multiple myeloma. That the cause is not really known. Some people just have more M proteins in their body. They may have called it MGUS for that. So just to monitor it closely to make sure she stays on top of it, that condition that she was speaking about. Yeah, that's it.
Okay. Somebody with the next question. Now, do you have a medication for poor circulation?
Thank you, Dr. Maggie. Yes, we do. We have the simple aspirin. Sometimes the poor circulation, what we do, we tend to give them the aspirin. So what the aspirin does, it actually helps to thin the blood. And once the blood is actually less viscous, then it's able to actually circulate better. But remember, yesterday we spoke about the aspirin that persons are not supposed to be taking aspirin. We have Daflon that is actually used as well. But the aspirin and some of these medications are not supposed to be taken for prolonged period of time, and your PTT and your PT is not being monitored, because
Some question about that.
Actually cut, you can actually bleed to death because your clotting factor would be affected there. So we do have medications, but some of these medications you have to be monitored. So you do probably your blood tests every 3 or every 4 months to monitor your PT and your PTT.
Okay, here's another question. After having a stroke and brain aneurysm, and what is the risk when taking the aspirin 325 dosage daily and have to do surgery, but the neurologist says to take the aspirin, to stop taking the aspirin is a greater risk than to staying on it during the procedure?
Well, I'm not sure if Dr. Maggie can answer that, but what we do here is that when our surgeons, when we're preparing patients for surgery, as the nurse, we are usually told to not give the aspirin for probably about 3 days or so, because you don't want the person to bleed to death while undergoing the surgery. Because as we mentioned, that these actually thin the blood, and remember that you're going to go in and cut
surgery. Yeah.
So that's what we do here. I'm not sure if Dr. Maggie would like to help on that one. What's her take on it?
No, definitely. You said it, you hit it on the nail. Hit on the nail. Exactly. You follow the surgeon's recommendation, because they're the one doing the surgery, because they can actually cancel your surgery if when they do their H&P and the anesthesiologist comes in and they ask what medication did you last take, and it was like within 7 or 10 days, they may cancel the operation. But what you should do is have them talk to each other, the neurologist and the surgeon collaborate.
Yeah, because the procedure I think is tomorrow and they're still taking their aspirin.
Ooh. Okay. She needs to it's 4:20. I think offices close at 5. Because I'm sure their pre-op has already called her to go through her list of medications and give her instructions to report to the OR. She needs to let them know that, or he let them know that she's been taking the aspirin. Will they want to do the procedure before she gets early in the morning and go fasting, and go there and they won't do it? So I would call the office, the surgeon's office immediately now. Ask them exactly what you need to do at this point. And then if the surgeon agrees to do it, then so, but they need to contact them tonight so they can either save that room for somebody else who needs it.
Right.
Yeah.
When you're doing it, sometimes it depends on it's very vascular, and that can be a lot of bleeding in itself. So
yeah.
Stop. But usually here, the annex would come and go through your docket, review your docket, look at all your blood parameters, look at the medication you're taking, and they sometimes decide if they want to put this patient to sleep. So they would liaise with the surgeon and the neurologist based on what the parameters that they're looking at, your blood results, the medication that you're taking.
The coag. Exactly. Yeah, she needs to make a phone call now and find out. I'm sure did the person online, did the pre-op nurse call her yet?
I'm gonna let you talk to that person because you know it's so I'm gonna let you talk to that person. You know it's so after I'm finished, you're on the line right now. All right. Is this question now? Is it good to take baby aspirin if you see visible sign of small clotting on your leg? And this sound like somebody being their own doctor, is it good to take baby aspirin like they want to medicate themselves, not going to the doctor?
And they're not baby aspirin, it's just that we use them differently. So most of the time we use the 325 milligram if we're suspecting that the person is probably having an acute episode of an heart attack and stuff. But as I mentioned yesterday, because of the impact of aspirin, it should never be taken without medical advice, because I've seen persons that would say that their relatives send down the aspirin and the barrel and they have been taking it for months without they don't have any underlying issues, they're just taking aspirin. So, this can have serious implication, whereas if they get a cut, as we said, then they can actually bleed to death because the blood is too thin and it don't have the ability to clot. So I don't think anybody at all should actually go ahead and take aspirin without a doctor advice, against a doctor advice, or if it's not prescribed. It is not a wise thing to do.
Yeah, because it sounds here like they see it and say, okay, the blood is clotting, so if I take it, it will do it. But you can be your own doctor. Dr. McGee, please check your chat. I just sent you the name of the person so you can call and talk to them. All right, so this one, nobody should try be like a Google doctor. Someone was asking if Daflon good for circulation. I think you just mentioned that that was one of the medication used for circulation, Daflon.
Yeah, that one can be used. That one we can use that sometimes for the varicose veins. But it also has another use sometimes for persons with hemorrhoids, because that hemorrhoids can be treated medically as well.
Okay.
It depends on how severe it is. If it doesn't resolve with the Daflon, then we can actually do surgical therapy.
Okay.
So the Daflon can be used, the aspirin can be used.
Okay, we're over time, but we want to finish the question. All right, so is there anything for low platelets? Anything you can do to increase your low platelets?
Low platelets, sometimes, well, it depends on whatever is causing. The thing with low platelets is to try and find out what is the cause, because it is very difficult to treat that condition. It's actually a condition that we call thrombocytopenia, and so it can actually cause bleeding as well. So usually sometimes we have to consult the blood bank to get them blood products and stuff to actually get back the platelet levels up. I had a friend recently that her platelet level was actually at like in the 20s. And they weren't sure. I think that prophetess had actually prayed with her and said it was actually leukemia, but that wasn't actually diagnosed. So because they didn't know what's the cause, they had to give her like chemotoxic drugs, and it's now back up to the normal. So platelets levels don't just fall like that. It's actually to find out what is the cause. So I'm not sure if there's like chemotoxic drug, or just to try and like give blood products.
Okay, we're coming down. We only have 4 more questions. I was told to eat a lot of yellow food for hypothyroidism, but I have poor circulation in the feet. How can I manage this?
Poor circulation is the same thing that we mentioned. Elevate
Someone's phone is open, please.
So you elevate the limbs when you're actually sitting, or when you're sleeping, you can actually elevate the feet on pillows. Exercising is always good. You have exercise actually do improve the circulation, and we do have exercises that are for cardio. I don't know though where the poor circulation is affected
in the feet.
Only thing, but the yellow foods doesn't affect the poor circulation. The only thing that would affect the yellow foods would actually affect is if the person having renal impairment, then we try to tell them not to have too much yellow foods because it's potassium. But other than that, if they have poor circulation along with the thyroid problem, they can go ahead and eat their potassium-rich food. But as we mentioned, that everything is a balance. So you try not to eat too much of any type of food.
Not too much. All right. Someone wants to know if skipping a good exercise to help your circulation.
Yes, it is. Because it's actually moving upper and lower limb, and it's actually good for cardio as well.
Okay, good. Now, my mom has high blood pressure and diabetes and dementia. I'm not sure how to help administer her meds because she sleeps a lot and have headaches. How can you help someone with those three conditions?
That is going to take a multi-team approach. The dementia in itself, that's sometimes the dementia, it's caused by sometimes it depends on the aging process of the person, because over time, the older you get, the brain shell shrinks, and so all of those things can cause the dementia because of changes that is happening within the nervous system in itself. The high blood pressure and the diabetes, however, those are circulatory conditions, and we do know it depends on how chronic the circulation condition is. That can actually lead to headache. As I told you before, that some persons are anemic to the point where they do get a headache because there is decreased perfusion to the brain. Remember, if there is not enough blood flow from the limbs going back to the head, then there's going to be a reduced flow. So you're having decreased perfusion to the brain. That sometimes can cause mild headache, but headache is not something that you can say pinpoint to one thing, because headaches are actually symptoms of many other conditions that this person can have. So it's always good it depends on the severity of the headache. It might be migraine. So it's always good to probably rule out by doing a scan to see if there is something else going on, why this person is having an headache. Because even though the person is having dementia, I'm not sure if that is actually an adequate, history to say that this person should be having an headache. So it depends on the severity of the headache. They can always get it checked out by actually doing additional scan, probably like a CT scan. So once that is clear, then it's actually, a multifactorial approach. Dementia is something that you just have to try psychotherapy, where you give them medication, and sometimes I don't remember between dementia. There's one of them that sometimes you usually give them photos of memories, things that are memorable to them, so you can
Like
actually take
Alzheimer's, long-term and the short-term memory.
and stuff. But
Yeah.
that's not what you can do for those conditions, because as I said, the older you get,
Your brain
actually degenerate,
deteriorate by the
right?
time you hit your 80s. It's
Causes
normal. Yeah.
circulate diabetes and the high blood pressure. Once you try to control those by actually, it's actually going to take a lifestyle changes where you're going to actually ensure that you change your diet. What you can do is actually speak with a dietitian to ensure that you get a diet sheet for her, so you can look at the portion size and the type of food that she's supposed to eat to control the diabetes. If she's actually, what should I say? If the person is actually compliant enough to do exercise, then you can probably try that. But if the person is dementious, I'm not sure how well they're going to comply with the exercise regime. So that's kind of difficult. But as I said, if you have a multi-team approach, then it can be done.
Okay, someone says now, the doctor prescribed Bayer aspirin for me to take with blood pressure medication, but they also are on, but I have never taken PT or PTT testing and taken aspirin for years, and I've never had those tests that you said to test the level to see how thin the blood is.
How do this person know though? Haven't you gone to your doctors, and have you ever done blood tests? Because when you do the blood test, you don't actually know what tests are they actually doing. Have you ever done blood tests when you go back to the doctors, like on whatever basis you go to refill the medication, or you just continuously fill at a pharmacy?
Can you answer that question, Grace, that did the doctor actually tell you, or do you know if they're doing it and just never did it? Another one says, my doctor gave me Promacta after I have my transplant. Okay. All right. Okay, how about poor circulation with osteoarthritis?
So that now can be a deadly combination, because the osteoarthritis in itself, it causes pain. And if you have poor circulation, it depends, as I said, remember that now the cells is actually being deprived of oxygen. So you're going to have an whole inflammatory cascade. You can end up getting cramps. You can actually feel heaviness in the legs, and that with the osteoarthritis, that is actually double inflammation there going on. So of course, that can actually increases the severity of the pain. So
Okay, so the last question, someone wanting, we're almost finished, just give me, it says, what is a normal blood pressure? We just can end that's basically the question.
Different book says different thing.
Yeah.
Normal range is like 120/80. However, it can
110
vary
over
with
70.
individual because some persons, and that is for non-pregnant women, for a 120/80 with a pregnant mother, that can be considered high. So it depends. But some persons are not used to having a blood pressure of 120/80. So what we do, we use a range, right? So it is always good to know the person to know what is their baseline blood pressure, because I may have a blood pressure that my normal, right, is probably like 110/70. And if I am actually having a 120/80, then that might be a little high for me. But most books will say 120/80, right? But we do look at a range. Maybe 160 is a bit low, but 110/70, 120/80, that's good enough. When you actually reach 130/90, then you're actually going in the pre-hypertensive stage. So at that stage, you now have to watch and try to, lifestyle changes, change your diet, exercise pattern, and your sleep pattern to see that you don't go over into the hypertensive stage.
Okay. The person who asked about the Promacta, they said that was for platelets. They were giving that for platelets. Somebody please. That was given to them for platelets, the Promacta.
Okay, and what are they asking now?
The question, let's go back to the question. My doctor gave me Promacta after I have my transplant, and that was for platelets. It didn't say what kind of transplant it was, but they're on Promacta for platelets. Remember, somebody was asking what to do if you can to manage your platelets, and I guess that's what they were referring to, that they got Promacta for platelets.
That is used. I know there are actually drugs that they use, but I'm not sure of all the names of them. So I guess that's
okay. All right, thank you so much. We're way over our time. It's 4:35, but we got through all the questions. We had 17 questions from yesterday, and we took some today. And I'm sorry you had a problem with your laptop, but we got through all the questions. I want to thank you so very much, because someone suggested this and I had no clue that this would affect so many people. But like you said, circulation affect just about everything that we do. So I did not know the depth of it, that it would go to this. But remember, everyone, that it's on YouTube. You can go to YouTube. People were calling me yesterday, how I need this information. It's on YouTube, Monica Jones Ministry. Like and subscribe, and you can get it. You can forward it to other people on Facebook, Monica Jones Ministry. Just like you're going to see my face, you're going to hear her voice, but on YouTube, you will see Rachel speaking and stuff. Thank you so very much. Remember, at 6 o'clock, we're going to be meeting for prayer meeting. And if you have not given to Feed My Sheep, please give your donation to Feed My Sheep. Let me put in my 2 cents. You cannot outgive God. And like they said, if you give to the poor, you are lending to the Lord. Amen. Today, someone sent off a pallet to Maxfield Park Children Home, and I had something to do with that. Someone is in Africa on Thursday, and they called me up, and I didn't even see their message. And in the middle of the night, I said, 9 minutes to 10. I said, you know what? I didn't see it. I'm not going to give them anything, and I'm going to say I didn't see it. And then I text them, are you up? They didn't answer. And I said, let me call them. And they answer. And when I gave them a donation to take to Africa, they said, you have no idea what you have done for me. And then I sent another. You just do the right thing. I was hungry and you didn't feed me. And I said, I don't want anybody to be hungry, and said, you didn't feed me. So I sent some to another person to give to another ministry. And tomorrow, the retired JDF soldiers, they have a branch in Florida. They're coming to my home to pick up another set of things to send to the retired soldiers. You cannot outgive God. Just give and then give some more. Amen. and I don't really like to ask, so I just do it. If people want to send me money, you send me money. I'm always doing something, but I don't like to ask because I don't want them to say you're asking me for money. So I do a lot of things on my own, but God is good. You cannot outgive God. Just help each other. We're here on this earth to help each other, whether it's with the information or if it's of your own goods, but do the best thing, and that is to feed somebody. That's the least you can do, is to feed somebody else. So God bless you. See you at 6 p.m. on the line. Amen. Let's I'm gonna
God
sign
bless
off
you,
now.
Tamika.
Thank you all so much for being here, and thank you, Rachel, once again. God bless you.
Once again,
God
for
bless
having
you, Tamika. God bless you, Rachel.
good
Yes,
thanks to all the participants.
Bless you.
yeah.
God bless.
God
You're
bless.
welcome, and thank you
Thank
all
you.
for staying with us. We went over today late, but it was good.